151. Which cranial nerve is assessed by asking a patient to turn their head against resistance? Answer: accessory nerve. Explanation: the accessory nerve controls the sternocleidomastoid muscle, assessed by head turning against resistance, critical for evaluating neurological motor function in clinical exams. 152. What is the primary nursing action for a patient with a suspected stroke in the emergency department? Answer: perform a neurological assessment. Explanation: a neurological assessment identifies stroke-related deficits quickly, guiding urgent treatment to minimize neurological damage and ensure patient safety. 153. Which brain structure is primarily responsible for regulating breathing rhythm? Answer: medulla oblongata. Explanation: the medulla oblongata contains respiratory centers that regulate breathing rhythm, critical for monitoring vital signs in neurological patients to ensure stability. 154. What is the primary symptom of a patient with a stroke affecting the cerebellum? Answer: ataxia. Explanation: a cerebellar stroke causes ataxia, or loss of coordination, guiding neurological assessments and safety interventions like fall prevention. 155. Which reflex is tested by tapping the brachioradialis tendon? Answer: brachioradialis reflex. Explanation: the brachioradialis reflex, elicited by tapping the brachioradialis tendon, assesses the C5, C6 spinal segments, critical for neurological motor function evaluation. 156. What is the primary purpose of administering nimodipine to a neurological patient? Answer: prevents cerebral vasospasm. Explanation: nimodipine prevents cerebral vasospasm after subarachnoid hemorrhage, a critical intervention to maintain cerebral blood flow and ensure neurological patient safety. 157. Which cranial nerve is responsible for hearing? Answer: vestibulocochlear nerve. Explanation: the vestibulocochlear nerve's cochlear branch transmits auditory signals, assessed to evaluate neurological sensory function and guide patient communication. 158. What is the most appropriate nursing intervention for a patient with a Glasgow Coma Scale score of 8? Answer: monitor airway closely. Explanation: a score of 8 indicates severe impairment, requiring close airway monitoring to prevent hypoxia, a critical safety measure in neurological emergencies. 159. Which brain area is responsible for processing motor planning? Answer: premotor cortex. Explanation: the premotor cortex in the frontal lobe plans voluntary movements, assessed to detect neurological deficits like apraxia in clinical evaluations. 160. What is the primary nursing action for a patient experiencing an absence seizure? Answer: ensure patient safety. Explanation: ensuring patient safety by guiding them to a safe position prevents injury during an absence seizure, a critical intervention in neurological nursing care. 161. Which spinal segments are tested by the patellar reflex? Answer: L2, L4. Explanation: the patellar reflex assesses the L2, L4 spinal segments, a key deep tendon reflex for evaluating neurological motor function in the lower limbs. 162. What is the primary function of the reticular formation? Answer: regulate alertness. Explanation: the reticular formation in the brainstem regulates alertness and consciousness, critical for assessing neurological status in clinical settings. 163. Which cranial nerve is assessed by testing taste on the posterior third of the tongue? Answer: glossopharyngeal nerve. Explanation: the glossopharyngeal nerve controls taste on the posterior tongue, assessed to detect neurological sensory deficits in clinical examinations. 164. What is the primary goal of speech therapy for a patient with aphasia post-stroke? Answer: improve communication skills. Explanation: speech therapy enhances communication in aphasia patients, a critical intervention to promote neurological recovery and patient independence. 165. Which brain structure regulates body posture? Answer: cerebellum. Explanation: the cerebellum coordinates posture by integrating sensory input, critical for assessing neurological deficits like ataxia to ensure safe mobility. 166. What is the primary nursing intervention for a patient with Bell's palsy? Answer: protect the affected eye. Explanation: Protecting the affected eye with lubrication or patching prevents corneal damage and Bell's palsy, a critical intervention for neurological patient safety. 167. Which cranial nerve is responsible for pupil constriction? Answer: oculomotor nerve. Explanation: the oculomotor nerve controls pupil constriction via parasympathetic fibers, assessed to evaluate neurological function in clinical settings. 168. What is the primary symptom of a patient with Huntington's disease? Answer: involuntary movements. Explanation: involuntary movements, or chorea, due to basal ganglia dysfunction guide neurological assessments and interventions in Huntington's disease care. 169. Which reflex is tested by tapping the biceps tendon? Answer: biceps reflex. Explanation: the biceps reflex, elicited by tapping the biceps tendon, assesses the C5, C6 spinal segments, critical for neurological motor function evaluation. 170. What is the primary purpose of a PET scan in a neurological patient? Answer: assess brain metabolism. Explanation: a PET scan evaluates brain metabolism to diagnose conditions like Alzheimer's, guiding neurological treatment and ensuring accurate patient care. 171. Which cranial nerve controls downward eye movement? Answer: trochlear nerve. Explanation: the trochlear nerve innervates the superior oblique muscle, assessed for downward eye movement, critical for detecting neurological deficits in clinical exams. 172. What is the primary nursing action for a patient with a suspected intracerebral hemorrhage? Answer: monitor blood pressure. Explanation: monitoring blood pressure prevents further bleeding in intracerebral hemorrhage, a critical intervention to ensure neurological stability and patient safety. 173. Which brain area is responsible for processing spatial awareness? Answer: parietal lobe. Explanation: the parietal lobe processes spatial awareness, assessed to detect neurological deficits like neglect, guiding patient safety interventions. 174. What is the primary purpose of administering lamotrigine to a neurological patient? Answer: prevent seizures. Explanation: lamotrigine, an anticonvulsant, prevents seizures, a critical intervention for stabilizing neurological patients and ensuring safety. 175. Which cranial nerve is assessed by asking a patient to puff out their cheeks? Answer: facial nerve. Explanation: the facial nerve controls cheek muscles, assessed for symmetry and strength, a key test for neurological motor function in clinical exams. 176. What is the primary symptom of a patient with a midbrain stroke? Answer: eye movement abnormalities. Explanation: a midbrain stroke affects cranial nerve nuclei, causing eye movement abnormalities, guiding neurological assessments and patient care planning. 177. Which spinal segments are tested by the Achilles reflex? Answer: S1, S2. Explanation: the Achilles reflex assesses the S1, S2 spinal segments, a key deep tendon reflex for evaluating neurological function in the lower limbs. 178. What is the primary nursing intervention for a patient with a Glasgow Coma Scale score of 4? Answer: initiate emergency airway management. Explanation: a score of 4 indicates coma, requiring immediate airway management to prevent hypoxia, a critical safety intervention in neurological emergencies. 179. Which brain structure is responsible for modulating pain perception? Answer: periaqueductal gray. Explanation: the periaqueductal gray modulates pain perception, assessed to evaluate neurological pain responses, guiding patient comfort interventions. 180. What is the primary purpose of a lumbar puncture in a patient with suspected meningitis? Answer: obtain cerebrospinal fluid. Explanation: a lumbar puncture collects cerebrospinal fluid to diagnose meningitis, a critical step for initiating neurological treatment and ensuring patient safety. 181. Which cranial nerve controls shoulder elevation? Answer: accessory nerve. Explanation: the accessory nerve controls the trapezius muscle, assessed by shoulder elevation, a key test for neurological motor function in clinical exams. 182. What is the primary symptom of a patient with Parkinson's disease? Answer: resting tremor. Explanation: resting tremor, due to dopamine deficiency, is a hallmark of Parkinson's disease, guiding neurological assessments and treatment to improve patient mobility. 183. Which brain area regulates circadian rhythms? Answer: hypothalamus. Explanation: the hypothalamus, via the suprachiasmatic nucleus, regulates circadian rhythms, critical for assessing neurological health and patient stability. 184. What is the primary nursing action for a patient with a suspected cervical spine injury? Answer: immobilize the neck. Explanation: immobilizing the neck prevents further neurological damage in cervical spine injuries, a critical safety intervention in emergency care. 185. Which cranial nerve is responsible for sensation in the pharynx? Answer: glossopharyngeal nerve. Explanation: the glossopharyngeal nerve provides pharyngeal sensation, assessed for swallowing safety, critical for neurological patient care. 186. What is the primary purpose of administering amantadine to a neurological patient? Answer: improve motor function. Explanation: amantadine enhances dopamine release to improve motor function in Parkinson's disease, a critical intervention for neurological patient mobility. 187. Which brain structure relays visual information to the cortex? Answer: thalamus. Explanation: the thalamus relays visual signals via the lateral geniculate nucleus, critical for assessing neurological visual deficits in clinical evaluations. 188. What is the primary symptom of a patient with a Pons stroke? Answer: facial paralysis. Explanation: a Pons stroke affects facial nerve nuclei, causing facial paralysis, guiding neurological assessments and patient care planning. 189. Which reflex is tested by stroking the sole of the foot? Answer: Babinski reflex. Explanation: the Babinski reflex, elicited by stroking the foot sole, assesses upper motor neuron function, critical for detecting neurological abnormalities in adults. 190. What is the primary purpose of intracranial pressure monitoring in a neurological patient? Answer: detect elevated pressure. Explanation: intracranial pressure monitoring detects elevated pressure, a critical intervention to prevent neurological deterioration and ensure patient safety. 191. Which cranial nerve controls eyelid closure? Answer: facial nerve. Explanation: the facial nerve innervates the orbicularis oculi muscle, assessed for eyelid closure, critical for detecting neurological deficits in clinical exams. 192. What is the primary nursing intervention for a patient with a seizure history? Answer: ensure a safe environment. Explanation: ensuring a safe environment by removing hazards prevents injury during seizures, a critical safety measure in neurological nursing care. 193. Which brain area is responsible for processing taste information? Answer: insular cortex. Explanation: the insular cortex processes taste, assessed to detect neurological sensory deficits, guiding patient care in clinical practice. 194. What is the primary symptom of a patient with a spinal cord injury at C5? Answer: quadriplegia. Explanation: a C5 spinal cord injury causes quadriplegia, guiding neurological assessments and interventions to support patient safety and mobility. 195. Which cranial nerve is responsible for the swallowing reflex? Answer: vagus nerve. Explanation: the vagus nerve controls pharyngeal muscles for swallowing, assessed to ensure safe oral intake in neurological patients. 196. What is the primary purpose of administering galantamine to a neurological patient? Answer: improve cognitive function. Explanation: galantamine enhances cognition in Alzheimer's disease by increasing acetylcholine, a critical intervention for managing neurological cognitive decline. 197. Which brain structure modulates balance? Answer: cerebellum. Explanation: the cerebellum modulates balance by integrating sensory input, assessed to detect neurological deficits like ataxia, ensuring safe patient mobility. 198. What is the primary nursing action for a patient with a suspected brain abscess? Answer: administer antibiotics as prescribed. Explanation: administering antibiotics treats infection in a brain abscess, a critical intervention to prevent neurological deterioration and ensure patient safety. 199. Which cranial nerve controls facial sensation? Answer: trigeminal nerve. Explanation: the trigeminal nerve provides facial sensation, assessed by touch or pinprick, critical for detecting neurological sensory deficits in clinical exams. 200. What is the primary symptom of a patient with a temporal lobe epilepsy? Answer: altered perception. Explanation: temporal lobe epilepsy causes altered perception, such as déjà vu, guiding neurological assessments and interventions to ensure patient safety.